Private notice question on hotel quarantine for travellers, Lord Hunt of Kings Heath.
My Lords, I beg leave to ask the question of which I have given private notice.
My Lords, these new measures at the border are a necessary step to protect the public and our world-class vaccination programme. Every layer of protection we have put in place will help reduce the risk of transmission of the virus and prevent any new potential strain from entering the UK. All measures will be kept under review and, if required, further action will be taken to add another layer of protection against transmission of the virus.
Lord Hunt of Kings Heath.
My Lords, given the good news on vaccine, shouldn't we be ever more vigilant on our borders? The 22nd of December meeting of SAGE identified the rapid spread of a variant in South Africa, and the NERVTAC meeting of 13th of January warned of the rapid growth of variant B1351 in South Africa and called for enhanced border measures. My Lord, since then, how many people have entered the UK from South Africa? And why, as Yvette Cooper said yesterday, is it still possible for people to return home to the UK from South Africa, go straight into the community with no tests on arrival, no quarantine hotels, and no quarantine taxis? Scotland has announced extensive new quarantine rules today. My Lords, when will the government get a grip and bring in much tougher quarantine measures they should have introduced weeks ago?
My Lords, I entirely agree with the Noble Lord. He is right that additional vigilance is required. The advent of new variants that could have higher transmissibility or escape the vaccine is a complete game changer. And that is why we have changed our approach to border management. We have upgraded our border border control measures, and there will be further announcements on that from the government. We've introduced red lists of countries where there are variants of concern, and we've implemented Project Eagle, which is the tracing project in order to track down those who have tested positively in genomic sequencing for variants of concern.
I call the next speaker, Baroness Jolly.
My Lords, the Minister will be aware that Australia is imposing a 2-week quarantine for all travellers flying in from abroad, with no exceptions. My son, who has dual nationality, is flying out in March to take up a job. He must have a negative COVID test result before flying and must stay in a hotel for 2 weeks at his own expense. My Lords, Australia has shown the way. When does the Minister expect the UK to follow?
Well, the Noble Baroness is completely right to cite Australia, and we take our hats off to their remarkable achievement in using their island status to protect the nation against the virus. We are responding to the challenge of new variants by upgrading our measures, and future announcements on this will be made shortly. But can I just note that the CMO's view on the variants of concern so far is that we should have a proportionate system, and that means an upgrading and not necessarily an Australia-style system. But of course, we are putting in place the kind of measures that could be upgraded to an Australia-type system were there to be a threat of significant magnitude.
Next speaker is Lord Lancaster of Kimbolton.
My Lords, yesterday the UK recorded 16,840 new COVID cases. Australia and New Zealand recorded 6 and 1 respectively. Of course, we shouldn't be encouraging people to travel to the UK, but some people have no choice for family reasons, for example. But can I simply encourage my noble friend that before we adopt a blanket approach for hotel quarantine, which may be appropriate for high-risk countries, we think about the cost. And can he reassure me that the government is more than capable of adopting a dynamic, risk-based approach to hotel quarantine?
Well, my Lords, my noble friend is right that we do have to be proportionate and we have to balance risk. But can I also flag that we are aware of the extreme measures that some passengers go to in order to avoid boundary controls. It is absolutely extraordinary the way in which some people will go to remarkable lengths in order to come to do journeys which are frankly dangerous and irresponsible. And to my noble friend's point, travel is normally something that I would consider a right, something that is of enormous value and something that I would fight for individuals to be able to do. But in a pandemic, it's different. In a pandemic, travelling is dangerous. You may be taking a variant of significant danger to the country of your destination, and it cannot be regarded as something that can be done easily and lightly as in normal times.
The next speaker is Baroness Marsham of Ilton. Baroness Marsham, are you with us? I'm not sure that helped. We might come... Baroness Marsham? No, we're going to come back to Baroness Marsham. Let's go to Lord Clark of Windermere.
My lords, the noble Lord the Minister said he believed that there was a basic right to travel. Can I put to him, there's an even greater right to live, yet we have the highest death rate per head of population than any country in the world. Shouldn't we put the right to live at the top of our agenda?
I couldn't agree with the noble Lord more. The right to live trumps all other rights. It is a sad fact that whilst we would normally in a liberal democracy do everything we can to protect rights such as the freedom to travel, under the current circumstances, these are trumped by the right to live. And that's why I call on all people to limit their travel wherever they humanly can. There simply is no excuse for going to Dubai, taking Instagram photographs of yourself and claiming that that is business travel. You are putting your friends and loved ones at risk, and this government won't tolerate it.
Call the next speaker, Lord Taylor of Gosmoor.
My lords, given the significant community transmission now of the South African variant, how confident is the Minister that we have today in place sufficient measures to stop the equivalent happening again? Because it does appear that the government is again running behind events.
Well, my lords, I would say that matters are are evenly balanced. There are 143 confirmed and probable cases of the variant first identified in South Africa. Most of those have been connected with travel to South Africa, and those involved have been isolated. There are around a dozen where that chain of transmission is not fully understood. We've put in place a substantial team of dedicated variant of concern tracing professionals in order to track down those variants, and we have put teams in place in the relevant postcodes that are doing both a fire blanket of testing within the community and forensic detective analysis to track down the chain of transmission. It's my belief that that will be enough to keep the spread of the virus under control in this country, but we are watchful and concerned.
We will return to Baroness Marsham after the next speaker, who is Lord Vasey of Didcot.
My lords, it may seem paradoxical to impose tough restrictions just when a version of the winning post is in sight, thanks to the Minister and his colleagues' excellent vaccine rollout. One thing that may give us some comfort, perhaps, is whether the Minister could update us on how effective he thinks, or his experts think, the vaccines will be against the new variants.
Well, my lords, the good news to date has been that the vaccines have proved to be extremely robust. Certainly the readout on the Kent domestic variant and the mutations of the Kent variant are extremely positive. A huge amount of work is going on to understand both the Brazil and South African variants. For South Africa, it would seem that the variant does do something to escape the vaccine, but not enough for the vaccine not to be extremely useful indeed. So the news to date is encouraging, but we are extremely watchful. And if there does emerge to be a variant, a mutation that can escape the vaccine, then we will do everything we can to protect that essential national project.
We're now going to return to Baroness Marsham of Ilton.
My lords, I hope you can hear me. I was frozen. My lords, say after quarantining in a hotel for 5 days or more and having had a test which proved negative, would a person be released? And if a person had to return to the UK because they needed urgent medical treatment, would they be admitted directly to a safe hospital?
Well, my lords, the details of the isolation protocols haven't been announced yet, but I would like to just suggest that the amount of time needed to flush out those who have got an infection from travel may need to be longer than the 5 days that the Noble Baroness indicated. And for those who have urgent need of hospitalisation, yes, of course, the NHS is there for them. We have the PHE and the infection control protocols in place to protect them.
Call the next speaker, Lord Green of Deddington.
My Lords, can the Noble Lord the Minister assure the House that any system introduced will be resilient enough to cope with a significant inflow from Hong Kong if that were to occur? As he will know, the government have just granted the right of entry and later settlement to up to 5.4 million from Hong Kong, roughly the entire population of Scotland.
Well, my lords, I share the Noble Lord's pride in that measure and concern that we extend a warm hand of friendship to those from Hong Kong. He raises the point extremely well. I would like to think that any system we put in place was resilient to surge demand of the kind he indicated, but I will take his point back to the department and check that everything is being done accordingly.
The next speaker is Baroness Wheeler.
My Lords, UK borders have knowingly been left open and potentially exposed people to new strains of the virus, rather than the implementation of the prompt concerted action advised by SAGE and a comprehensive hotel quarantine system brought in for all UK arrivals. Does the Minister accept that the current 10-day self-isolation system's failed? If so, why is that still the policy being pursued for the majority of travellers? What we've been promised is that hotel quarantine will be implemented for some countries as soon as possible, with some reports suggesting that this won't be enforced until the week of 15th of February. Can the Minister confirm whether this is the target date? Will additional measures be in place for travellers from the red list of countries in the interim? And finally, does he accept that a partial quarantine is doomed to fail, given that global travellers may move across many countries during their journey, passing through multiple travel hubs and departure lounges, encountering and spending time close to many other travellers along the way?
Well, my lords, I acknowledge the very detailed and perfectly reasonable questions of the Noble Baroness. I am, however, unable to answer them all in detail because a statement will be forthcoming from the government on exactly the questions she raises. I would remind her that travel has come down by 90% since this time in a comparative period. She is entirely right that travel patterns are complex. So any measures we do put in place will recognise the fact that many travellers leapfrog from one country to another, they brush against other travellers, and that the spread of the virus cannot be narrowly contained to travel corridors in the way that sometimes one would like to hope.
I call the next speaker Lord Sarfraz.
My Lords, can I ask my noble friend the Minister if we will try and monitor the physical and mental health and well-being of those in hotel quarantine, including vulnerable travellers, travellers with disabilities, and those with small children?
Well, the Noble Lord is entirely right to be concerned about those who travel for essential reasons, but who may face some hardship through their journey. And we are putting in place special arrangements in order to ensure that they are looked after in the best way possible. But I would remind both the Noble Lord and the Chamber that the purpose of these measures will be to reduce dramatically the amount of travel. Travel is no longer a right, it is a danger, and as a result, everyone needs to think very seriously before they commit to a journey.
I call the next speaker Lord Lumba.
My Lords, we need to control the new variant strains from entering the UK by controlling the travel corridors at airports and seaports if we want to avoid a third wave of COVID-19. Can the Noble Lord, the Minister, tell us if the government deems the mandatory hotel quarantine as an important step to ensure the safety of the nation from further devastating deaths of COVID-19 and overwhelming pressure on our NHS? and considering the huge impact this would have on immigration, police, medical staff, and the participating hotels at the airports and seaports around the country. Thank you.
Well, the thrust of the Noble Lord's question is entirely right. We are living now in different circumstances. The variants of concern could emerge to being a real threat to the vaccine. And this government will do whatever we can in order to protect the deployment and reassurance that the vaccine has given to millions of people, and to protect our hospitals, our NHS, and to protect life. And therefore we will do whatever it takes. And he is right that travel arrangements of people do need to be subject to mandatory control, and it isn't possible to hope that people will go home and isolate in cases like this, that hotels may play an important part of ensuring that that mandation is truly effective. Our plan processed at the moment, our monitoring of the variants of concern is being upgraded massively with huge investment in international surveillance, and we will be updating the House accordingly.